therapy. He develops a urinary tract infection and is prescribed trimethoprim sulfamethoxazole. A few days later, his INR rises sharply. What is the most likely cause? A. Increased vitamin K absorption. B. Drug-drug interaction, leading to reduced warfarin clearance. C. Warfarin resistance. D. Increased renal excretion of warfarin. Answer B. Explanation. TMP-SMX inhibits CYP2C9 metabolism of warfarin, leading to elevated INR and bleeding risk. 2. Clinical pharmacy Q2. A patient with asthma presents with worsening shortness of breath after starting propranolol for migraine prophylaxis. Which principle explains this? A. Drug-induced tolerance. B. Pharmacodynamic antagonism. C. Synergistic effect. D. Pharmacogenetic variation. Answer. B. Explanation. Non-selective beta blockers antagonize BEAT2 receptors in bronchi, causing bronchospasm. Number 3. Hospital pharmacy Q3. During a hospital audit, multiple cases of central line infections were traced back to poor aseptic dispensing practices. Which is the best intervention? A. Switch to oral antibiotics for all patients. B. Enforce strict laminar airflow hood use. C. Increase dose of antibiotics prophylactically. D. Eliminate parenteral nutrition therapy. Answer B. Explanation. Aseptic compounding in laminar airflow hoods is critical to preventing nosocomial infections. Number 4. Hospital pharmacy Q4. A nurse reports a medication error where an insulin dose was given twice in one morning. What is the most appropriate pharmacist response? A. Ignore as hypoglycemia can be corrected. B. Report through medication error reporting system. C. Blame the nurse and write a warning. D. Discontinue insulin permanently. Answer B. Explanation. Medication error reporting is key to quality management and preventing recurrence. Number 5. Community pharmacy. Q5. A mother comes to the pharmacy asking for antibiotics for her child's viral flu. What should the pharmacist do? A. Dispense antibiotics to satisfy the parent. B. Recommend supportive care and explain antibiotics are unnecessary. C. Dispense a low dose of antibiotics, just in case. D. Refer to a tertiary care hospital immediately. Answer B. Explanation. Antibiotics are ineffective against viral infections. Pharmacists must educate and prevent misuse. Number 6. Community pharmacy Q6. A man collapses outside the pharmacy with sudden chest pain and sweating. As a first responder, what is the immediate first aid action? A. Give nitroglycerin if available and call emergency services. B. Provide a large glass of water. C. Give insulin injection. D. Massage the chest. Answer A. Explanation. Classic symptoms of myocardial infarction, immediate nitroglycerin, if prescribed, and emergency help. Number 7. Pharmacotherapeutics. Q7. A patient with hypertension and diabetes is started on an ACE inhibitor. 2 weeks later, serum potassium is 6.2 millimoles per liter. What is the likely explanation? A. Drug-induced hypokalemia. B. ACE inhibitor reduces aldosterone, leading to hyperkalemia. C. Increased renal excretion of potassium. Random laboratory error. Answer B. Explanation. ACE inhibitors decrease aldosterone secretion, potassium retention, hyperkalemia. Number 8. Pharmacotherapeutics. Q8. A 52-year-old female breast cancer patient on doxorubicin presents with progressive shortness of breath. Which adverse effect is suspected? A. Nephrotoxicity. B. Cardiotoxicity, congestive heart failure. C. Hepatotoxicity. D. Neurotoxicity. Answer B. Explanation. Doxorubicin causes dose-dependent cardiotoxicity due to free radical damage. 9. Regulatory guidelines. Q9. A pharmaceutical company submits an application for approval of a generic oral antibiotic with the same strength, dosage form, and route as the brand. Which regulatory submission is required? A. IND, B and A, C. NDA, CTD, module by only. Answer B. Explanation. Abbreviated new drug application, NDA, is filed for generic drug approval demonstrating bioequivalence. Number 10. Regulatory guidelines. Q10. A randomized controlled trial on a new anti-diabetic drug shows significant benefit but failed to blind participants due to drug's strong taste. Which type of bias is most likely introduced? A. Selection bias. B. Performance bias. C. Detection bias. D. Attrition bias. Answer B. Explanation. Lack of blinding affects patient-clinician behavior. Performance bias.